Welcome, my dear friends. Myself, Professor Dr. Rajendra Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, you can definitely WhatsApp on 922681060. My dear friends, although the video is in English, subtitles are available in English, Hindi, Marathi, etc. I am giving you this audiobook regarding Kayachikitsa, that is Ayurvedic internal medicine. Today, the part 4 is there, and we are discussing the different treatment modalities in Ayurvedic medicine. We have discussed already in the last part about Shodhana and Shamana. Now I am going to tell you another classification of Chikitsa or the Ayurvedic management. The three types are: first is Apakarshana. Just wait, these are the Sanskrit words. Second, Prakruti Vighat. And third is Nidana Parivarjana. Most important. So let us talk one by one. First is Apakarshana. What do you mean by Apakarshana? Apakarshana Sanskrit word means removing anything by force. This is again subdivided into Bahya Apakarshana. That means surgical removal of tumor is Apakarshan according to Ayurveda. And Abhyantara Apakarshana. That means removing the vitiated Vata Pitta Kapha by the Panchakarma. That is taking out Apakarshana. Second part is a Prakruti Vighat. That means to break the pathogenesis by means of either external applications or by giving internal medicine. We have to destroy the pathology in the disease. And last but not least is a Nidana Parivarjana. Ayurveda has a Sanskrit quote, Sanshepatah Kriyayogo Nidana Parivarjanam. If any person in any disease try to avoid the possible causative factors, he can definitely be cured earlier, and also he will be benefited by improving immunity. So, nutrition, he has to do the pathya and apathya. Doctor will tell which food is good, which food is not good. The person is suffering from sinusitis. So Ayurveda says cold food stuff, cold drink, air conditioning is bad. If the person is following that things, he should stop that particular causes, then only his sinusitis will be reduced. If the person is obese and having the habits of eating sweets, pizza, burger, then he has to stop that. Otherwise, obesity Triphala Guggulu tablet will not work. Do you understand? So, food and behavior are also included in this particular Nidana Parivarjanam. Along with the purification and palliation, Nidana Parivarjan is most important. Okay? So I have discussed one classification of Ayurvedic management. Now I am going further. Another classification. There are three types. Hetu Viparita Chikitsa, Vyadhi Viparita Chikitsa, and Hetu Vyadhi Viparita Chikitsa. For example, Hetu Viparita means contradictory to the causes. Suppose a person is having cough with lot of cold drinks, we will advise him to drink the warm water. So this is very according to the Hetu. Hetu means causes, opposite to the causes. Vyadhi Viparita, some drugs are very specific for particular diseases. For example, if I find the person is suffering from anemia, I can give him the Pandu Roga Adhikara medicines, which are very specifically mentioned as treating the anemia, like for example, Tapyadi Lohavati. Okay? And third is a Hetu Vyadhi Viparita Chikitsa. Suppose a person is having the obesity because of what you can say the eating a lot of high calorie food. I will give him the fasting, Hetu Viparita, and also Vyadhi Viparita Trifala Gugulu tablets. Okay, for obesity. This is another classification of today's discussion on Ayurvedic management. Now, my next topic, we are going further. We are discussing a lot about Kayachikitsa, internal medicine. How to do the assessment of Ayurvedic treatment. Simple, treatment must bring about certain improved results in the patient to be regarded as successful treatment. Whatever the methods of treatment that we are applying, having the several principles, of which the following principles are more important. Whatever treatment modalities you use, but we have to consider the constitution or prakriti or the biotype of the patient. Number two, we have to consider the patient is child, young, or the old person, age. Third, we have to see the adaptability of the person. साथ में what he can tolerate. Suppose the person is vegetarian and I am prescribing some non-veg food, he will not tolerate. Then we have to consider the status of the bioenergies or the doshas, whether samavata or the niramavata, samapitta or the niramapitta. Then I have to consider rasa, rakta, mans, med, asti, majja, shukra, different body tissues, plasma, blood, muscles, fat, osseous tissue, nervous tissue, reproductive tissue, how their qualities. Then I have to think of waste product like mutra, purish and swed, urine, stool and sweat, how they are. I have to consider the metabolic status, Agni, Jatragni, Dhatvagni. Then I have to check the different channel system which Ayurveda called as a Srotasa. Pranavah Srotas, Rasa, Rakta, Mansa, Medavah Srotas, etc. And then last but not least, I have to check the immune status or the ojas of the patient. The specific medicines, their doses, and modes of administration are suitably selected in each individual case depending upon such relevant factors. That's why Ayurvedic treatment is called as tailor-made treatment. The degree of success of treatment can be measured by number one, following indication: relief from the pain of the disease. Number two, improvement of the voice and complexion. Number three, normalization of the body weight. Number four, increase in the strength and vitality. Number five, desire for food and improved appetite. Number six, relish or the taste for the food while eating, timely and proper digestion. Sixth is a good sleep at the proper time, feeling of happiness and vitality upon awakening, and last is proper elimination of urine, stool and flatus. So my dear friends, in this lecture, in the last section, audiobook, I am telling you about Chikitsa Purusha. What is Chikitsa Purusha? In a simple sense, this is nothing but the patient. The person to which the doctor is treating, Ayurvedic Vaidya is treating, in Ayurvedic terminology, that patient is called as Chikitsadhisthit Purusha. Chikitsa means treatment, Purusha means human being, maybe male, maybe female. According to the Sankhya philosophy, Purusha has no form, no size, no shape, and is a pure consciousness. The creation of the universe takes place only when this particular pure consciousness Purush combines with Prakriti or the matrix of the universe. Charak has called this Chaturvyamshatika Purush or Rashi Purush, amalgamation of the different elements. In Sharirasthana of Charaka Samhita, they have mentioned Ek Dhatu Purusha, meaning soul or only consciousness. However, our entire Ayurvedic management or the treatment is aimed at living person, who is composed of five basic elements, that is Panch Mahabhuta, sense organs, mind and soul. Hence, in Ayurveda, the living person is called as Chikitsadhisthit Purusha. As the living person is composed of five elements, Panch Mahabhuta and soul, has also been called as a Shad Dhatuka Purusha, because there are six elements. One is consciousness and five Mahabhutas. Other synonyms like Karma Purusha or the Sthula Purusha also indicates the living person is the most important for Ayurvedic treatment according to the science of Ayurveda. So my dear friend, this is all about Kayachikitsa part 4 audiobook. There may be hundreds of the lectures, audiobooks, and you will be definitely enjoying all these my lectures like audiobook. So I request all of you to like this video, share this video. Please comment how do you feel with this particular information, and then don't forget to subscribe my YouTube channel. Thank you very much. Take care. See you in the next part of our internal medicine or Kayachikitsa part number 5. Thank you.